To Americans for Tax Reform, Paul Blair. Paul, thanks for coming on in.
Absolutely.
Good to see you. I know you're in the middle of this issue. The president in the Oval Office, alongside the First Lady and the HHS Secretary, gave the impression that there would be a complete ban in September. This is going to be a reversal, we believe. Why?
I think for a couple of reasons. First, the facts have become a little bit more clear today than they were in September, when a lot of the vaping illnesses and even in some cases deaths were falsely attributed to legal nicotine products. What we now know today, as a result of an examination that the CDC has done, is that the products that were getting people sick across the country were black market, illicit marijuana and THC products. They were not legal nicotine products that adult smokers are using to quit that you can find in convenience stores or vape shops. And so that's, I think, a part of what has led to this change in opinion.
There has been more data. There's been data specifically on youth and youth usage that has come out, but there's also been polling that we know. And according to some of the polling that was done by McLaughlin and Associates just a few months ago, here's what that polling shows. The question was, if the Trump administration bans the sale of flavors in all nicotine vapor products, would that make you more likely or less likely to vote for President Trump for president? More likely, 2%, less likely, 74%. The White House saw this polling, and then it got the vaping industry in its ear. You could argue that this is the swamp that the president has campaigned against.
Well, look, I mean, I think the vapor voter is an important component of the modern right-of-center political coalition. And I do not think that in September, the White House fully understand how passionate the people who have successfully quit smoking with e-cigarettes felt about preserving access to those products. And so this was a grassroots campaign across the country of adult vapors, of which there are about 13 million, weighing in with the White House to say, slow down, maybe consider sensible regulations, because the 1920s weren't exactly a successful test case in what prohibition.
Is this a public health crisis among children?
I think teens are always going to experiment. They have with marijuana, despite it being an illegal Schedule I substance for so many years.
But is it a public health crisis among teens?
I mean, we don't want teens using nicotine. You don't want teens using these products. But we have to balance the importance of these products with adults, with limiting adult access or teen access to these products, which we've done by doing things like raising the age to use these products to 21, which the president just signed.
Speaking of that, you can't get a job now at U-Haul if you smoke, or at least starting next month. The truck and trailer company says it will stop hiring smokers and nicotine users in 21 states. So if you smoke, you want a job at U-Haul, 21 states, they're going to say, no, we're not hiring you. Your thoughts there?
That's a little silly. It's a little silly. I mean, I think that you certainly don't want adults wasting time on the job, but to limit their ability to use these products as a precondition for employment, I think moves in the wrong direction for entrepreneurs or people who are entering the workforce. And I think it's kind of silly that states would move in that direction.
What if they were to say you can't vape?
Well, in many cases, adults who are vaping are quitting smoking, so that'd probably be even more absurd than limiting their ability to smoke, because at the end of the day, you want consumers to transition to less harmful activities. And so if you tell an adult they can't do that, in many cases, you're telling a smoker they should keep doing that, and that'd be a reckless decision.
Paul Blair of Americans for Tax Reform. Got to leave it there.
Thanks.
Paul, good to have you in.
Absolutely. Thanks for having me.